We turn back now to our top story of the day. Lawmakers try to get clarity from Health and Human Services Secretary Kennedy about his agency's recommendations related to COVID-19 vaccines. CDC recommendations are advisory opinions that, because of the laws in some states, carry the force of law. To help us understand what's happening and what we need to know, earlier I spoke with Brigid Groves. She's the Vice President of Professional Affairs at the American Pharmacist Association. Pharmacists are the most accessible healthcare providers. You're on the front lines of public health, which includes administering vaccines. So have you heard about confusion with respect to COVID-19 vaccines?
Yes, given the recent approval from the FDA on the COVID-19 updated 25-26 vaccine and changing some of the indications that we had seen in the past couple of years, as well as the fact that the CDC's ACIP or Advisory Committee on Immunization Practices hasn't met yet to discuss and recommend the updated vaccine for COVID, there is some confusion out there among who should get it and when they should get it, as well as where they can get it this upcoming season.
And what is the nature of that confusion? Because you also have doctors weighing in with a different set of ideas about who and what and where and when.
Yes, we know with the FDA indication that older adults over age 65 are eligible. Patients that are ages 6 months to 64 years that have a high-risk condition, putting them at greater risk of severe COVID, are eligible for their updated vaccine as well. In the states, though, pharmacists' scope of practice is authorized by their individual state. Therefore, some states actually state when a pharmacist can administer a vaccine is according to that ACIP schedule and having to have the CDC endorsement and recommendation. Since that hasn't happened yet in certain states, pharmacists are currently not authorized to vaccinate. But we are working together with those states to assure that our patients still have access to their COVID-19 vaccine from their local pharmacist.
And how are you working with the states to make that happen?
We are reaching out to the state governors, to the health departments, and working very closely with our state pharmacy, boards of pharmacy, and associations, working on updating languages and protocols to assure that the most evidence-based and data-driven recommendations are used to guide what patients can get for the updated COVID-19 vaccine. Making these protocol modifications and executive orders in those states where it's currently not authorized will allow expanded access and really make sure that truly every American that needs and wants a vaccine for COVID can get it.
So I come to you, I don't know what to do with all of this I'm hearing about on the news. Help me. What do you tell me?
Yes, as a pharmacist, it's very important for us to make sure that our patients' needs and concerns are heard and met. So go talk to your pharmacist, ask them your questions. Who's eligible? When can I get it? And make sure you make your appointment or walk in. Check to see what availability might exist. That pharmacist will work with you to make sure it's the right medication, or in this case, the right vaccine for you or for your family. It's important to ask them your questions and make sure you get your insights clarified up front and make sure that you make that right decision for you and your family.